Good morning, this is Dr. Mirrafati from Mira Aesthetics. Today we're discussing capsular contracture. What is capsular contraction after you do breast implant? And why does it happen? I mean, why does everybody get capsular contraction? So our topic is, what is capsular contraction and how do we treat capsular contraction? So there's 4 degrees of capsular contraction. First of all, everybody gets capsular contraction. Grade 1. Grade 1 means the body does not like the implant. It's a foreign body to us, right? So when we put an implant inside, either under the muscle or over the muscle, the body sees this as a foreign object. And obviously, they can get rid of it, and it's very rare occasion where we have the implant exclusion, body gets rid of it, but that's very rarely happens, especially if you go from axillary, there's really no way to can extrude it. But anyhow, and in the last 8,000 implant that I've done, haven't had, knock on wood, implant exclusion. But, so it's very rare for it to happen. So it cannot extrude the implant, and what it does do though, it says, listen, I can't get rid of this implant of this foreign body, I don't know what it is, but I'm gonna put a shell around it. I'm gonna protect this, as if I know if this foreign body is protected and is enclosed or engulfed by my scar tissue, by my surrounding, I know where it is, so I have a peace of mind. This foreign body is not going to do any harm. It's there. So that's grade 1 capsular contraction. Grade 2 is the body puts a little shell around it and goes home and says, I wonder if this foreign body is going to cause more damage. So let me go back and put another wall around it and secure it even tighter. And then next day, let me just put another round around it. So now we have grade 1 and sometimes grade 1.5. And then grade 2, you can feel the capsule. I mean, it's there. You can pretty much feel the capsule. It's hard because the body just basically, instead of putting in regular cell house, now we're in solitary confinement where the walls are thicker and the body says, I'm okay. But that's why people who have autoimmune disease or people who are asthmatic have a higher chance of capsular contraction because their body already on a hyper alert anyway. So when you put an implant, hyper alert, boom, let's put a capsule, let's put a thicker capsule around the implant. Now, so that's thicker capsule, grade 2. Grade 3 is not only is this wall that's put around the implant is thick, but also squeezing an implant and cause deformity. So now you have hard and also a deformed breast. So when you're looking at implants kind of moved up in the superior aspect and it looks deformed. And obviously grade 4 is deformed, hard, and painful. So when do you change implant? In my practice, I normally change it when it's grade 3 or grade 4, which means when it's deformed, I change it. It's already deformed. Grade 4, then you definitely change it because now it's deformed and the patient has pain. Patient wants it out. It's like, it's painful, get it out. It's just really putting pressure. Now, it doesn't happen that often, especially in our practice, since as you guys probably know, I go from the armpit. So in my opinion, the less trauma you impose to the body, which is probably the least trauma to the body imposed if you go through the armpit, the less chance of capsular contraction you're going to have. And it's shown over the 8,000 implant that we have done that our capsular contraction is way below what the national statistic is. However, now you got grade 1, you don't do anything. Grade 2, I do proactive. First of all, most capsular contraction happens within the first year. It really does within the first year. If it's going to happen, it's going to happen within the first year. And about 90% of it actually was the first 6 months because that's where the body feels this implant as a foreign body and you might have a little bit of a bleeding there that causes more inflammation and that inflammation brings a scar tissue. So it generally happens within the 6 months or most of it happens within the first year. It's very rare for somebody to have a capsular contraction maybe 10, 15 years out, but it does still happen. Maybe you probably have a little extra trauma to the chest wall and there's a little crack in the capsule and body comes in to fix the capsule and says, oh my God, there is a foreign body there, let me put more wall around it. So the body doesn't see that tear as a capsule as exogenous effect. It sees that that implant is what caused that tear in the capsule. Remember, body sees it as it is there. It's not logically going to say, oh, it was possibly maybe hard sex or maybe an accident that did this. Body sees that tear caused by that implant and obviously puts a wall around it. So it can happen a few years down the line, but generally happens within a year. So when do you go treat it? So if in my practice, if they come to me within, normally everybody comes the next day and 6 weeks and everything's fine and dandy, and they come back 6 months later, if they're a little hard, I start to get proactive on this. I don't just let it go. Now I know there's a lot of literature that talking about squeezing it, what we call external capsulotomy is not called for, but I think if you do a gentle external capsulotomy where you're able to squeeze that capsule a little bit and right away put ice on it and put them on some sort of an anti-inflammatory medication, you might reverse the capsular contraction without residing into surgery. Obviously, if it's grade 3 and grade 4 with surgery, but now at grade 2, we want to avoid surgery. We want to avoid extra costs for the patient. We want to avoid extra hassle for the patient. So what do I do in my practice? I actually start patient on vitamin E, fish oil, CoQ10. Now, I don't have an implant inside me at all, but I love taking this and I take it almost every day. Well, not almost, I take it every day because it's a good anti-inflammatory, reduces the inflammation in my body, which is good for my overall health, right? So taking fish oil, CoQ10, vitamin E is already good for you. So how often should I take it? Forever. Just take it for your regular health. Now, if you have implant, then you should actually take it for sure. Now, for female, vitamin D is also a must. Another caveat to this, I add milk thistle. Milk thistle is great for your liver detoxification and reducing inflammation. So milk thistle, vitamin E, fish oil, CoQ10. For female, actually, with implant, with no implant, D3 is a must. You take that. Now, if the capsular contraction, it's a grade 2, but it is at the lower verge of a grade 2, which almost getting to a grade 3, I also introduce another medication called Singulair. Now, Singulair, it's an anti-asthmatic medication. When you go to the pharmacy to fill the prescription, first of all, it has to be done with prescription. When you go to a pharmacy to fill a prescription, they ask you, are you asthmatic? Some insurance company, if you say no, they won't fill it. So however you want to say it, basically, as I mentioned at the beginning, people who have asthma, autoimmune disease, they're already hyperimmune for capsular contraction. So basically what it does, asthma is the same situation because your body reacting to the pollen, to the outside, to something that is foreign body and is inflaming your lung and you start coughing and getting congestion and all that other stuff. So if I can reduce the inflammation in my body by using Singulair, it has shown it can also reverse the capsular contraction. So if you are going to go using Singulair, 5 milligram once a day, so you do it for 3 months, then I give them another refill for 3 months. So before I reside to surgery, I always do a 6 months trial, 3 months and 3 months to see if I can reverse it with all the vitamin and mineral that I told you to take, plus the Singulair. So basically, it's 10 milligram per day, 10 milligram Singulair Q day for 3 months, and then you repeat it again for another 3 months. So Singulair is anti-asthmatic, reduces the inflammation in your gut. You got milk thistle, which is great liver detox, vitamin E, another liver detox, and also reduces inflammation. CoQ10 it's obviously, we all know is how great that is. And fish oil. Fish oil is amazing. It's overall cell integrity and reduces the inflammation. So those are the regimen that I start patient on when I see a capsular contraction grade 2. I don't just let it go by chance. I proactively start the patient with a little what we call the external capsulotomy by putting pressure on that implant, possibly trying to loosen it up a little bit. And then after obviously 6 months, if most of my patients reside back and become softer, then we know we're in the right track and we repeat the cycle again. And again, the goal is not to repeat the surgery for the patient. Obviously, you don't want this to be a bad experience for them, and you don't want them to go through 2 surgeries. So that's what I do in my clinic. Let me know if you guys have any question, write it in the comment and I answer those questions. Otherwise, stay healthy. Anything else you guys want me to do a video on, let me know and I will write a video.